Hello, I'm Karen Parry, manager of the libraries Just for the Health of It Health Literacy Initiative at the East Brunswick Public Library. I'm joined here today by Dr. Eugene Shostak, who is an assistant professor of medicine in cardiothoracic surgery, who specializes in interventional pulmonology at New York Presbyterian Hospital at Weill Cornell Medical Center. Welcome, Dr. Shostak.
Hi, thank you, Karen. Thanks for having me here today.
I'm very excited to talk about a very unique program that will be happening by Zoom, offered through the East Brunswick Public Library. So I'm very excited to have Dr. Shostak here to give us a little bit of an overview of what will this program entail for our viewers. So welcome, Dr. Shostak. And my first question for you is, your biography states that you are an interventional pulmonologist. Can you please describe for our viewers what is an interventional pulmonologist and what do you do?
Yes, thank you, Karen. An interventional pulmonologist is a lung specialist who has expertise in performing pulmonary procedures. Many patients see us for a biopsy in order to establish a potential diagnosis of a cancer. And all of the procedures are performed bronchoscopically, minimally invasively using a small camera with no incisions and no need for surgery. During the bronchoscopy, we are able to examine the windpipe and the bronchial passages using a small camera. We can also access various structures for a biopsy, such as lymph nodes or small lung nodules. And we use latest technology, such as ultrasound, to visualize lymph nodes, and the GPS technology to snake small instruments into the periphery of the lungs and accurately sample small lung nodules. We also have access to robotic technology, which is the latest and the most sophisticated piece of technology that enables us to diagnose lung cancer early. There are some patients who can present with respiratory problems related to buildup of fluid around the lungs, or even obstruction of airway passages, making it difficult for patients to breathe. And then interventional pulmonologists have multiple tools that can alleviate symptoms of breathlessness, either by drainage of the fluid or even placing stents to reopen the bronchial tube. So there are many different procedural services that we are able to offer to our patients who are suffering from an obstruction or other types of pulmonary complications related to their underlying disease. In addition to lung cancer, interventional pulmonologists are able to offer minimally invasive endoscopic treatments for certain patients with severe asthma and emphysema. These treatments are used in conjunction with medications to improve quality of life, improve with the need of oxygen, and improve the general well-being of the patient.
Okay, that's very interesting. Doctor, your program states that you will be covering lung health in the community. Can you very briefly tell our viewers what areas of lung health will you be covering?
Yeah, absolutely. We will address COPD, which stands for chronic obstructive pulmonary disease. It is the most common smoking-related lung disease in the United States that affects over 16 million people. COPD is caused by smoking. It can result in various symptoms such as chronic bronchitis, shortness of breath, and predisposition to pneumonia. We will discuss smoking cessation and safety profiles of various vaping and electronic cigarettes. And given the high prevalence of lung cancer in our community, we will also be discussing lung cancer screening and other general information pertaining to lung cancer education.
And Doctor, my last question is this a program just for smokers, or who else might want to attend?
Yeah, Karen, it's really not just for smokers. It's really for anyone in the community who is interested in learning more about general lung health, learning more about prevention of chronic respiratory problems, and anyone who has general questions about lung cancer.
Well, thank you so much, Dr. Shostak, and I hope our viewers will certainly tune in. The link will be on the library website from 7 to 8 p.m. Thank you again, Doctor, for your
Great.
time, and we hope we'll see all our viewers.